Right now at 4:30, after years of political battles, we now know when hundreds of thousands of low-income people will get health coverage in North Carolina. Governor Roy Cooper announcing today in just over 2 months that expanded coverage will officially take effect. It's part of the budget that the legislature just passed. And our Capitol reporter Michael Hyland live in Raleigh for us today. Michael, some people have been waiting for this for a very long time.
Yeah, there are still several things that are going to happen to get everything into place, but the governor says this health coverage will take effect on December 1st. In all, 600,000 people will qualify, and on day one, about half of them will get coverage right away. The state is working to try to contact people in other benefits programs who may be eligible and encourage them to apply. A family of four making about $41,000 a year or less could get free or low-cost coverage under this program. Republicans agreed earlier this year to go forward with Medicaid expansion, but made it contingent on the state budget passing. After months of delays, it passed late last week, and the governor has decided to let it go into law without his signature, despite his objections to other parts of it.
And even though a veto of this budget would have been well-deserved, that would take this bill out of my hands and send it back to this legislature, where even more mischief could have put Medicaid expansion at risk.
With the threat of a federal government shutdown in a few days, I also asked the governor whether that could have any impact on the timeline for Medicaid expansion. He said he has been talking to federal officials about that, but people who are involved in this would still be working, so he does not think that this will be slowed down because of that. Live in Raleigh, Michael Hyland, Queen City News.